Our last presenter is Dr. Trefz, and he's particularly keen to get on the podium. So we better let him up and give his presentation.
Thanks
for
the introduction, Mr. Chairman. I'm very happy for giving me the opportunity to present the results of one of our current research projects, addressing the prevalence, associated clinical conditions, and prognostic relevance of hypoglycemia in hospitalized neonatal calves. So we all are aware of the fact that neonates are provided with limited energy reserves, such that conditions like disease, maternal rejection, injury, congenital defects, or management errors can potentially lead to derangements of blood glucose homeostasis in neonatal calves. Hypoglycemia was reported to be a common feature in critically ill neonatal foals that were admitted to intensive care units, and hypoglycemia was associated in that studies with a diagnosis of septicemia, positive blood culture results, evidence of the systemic inflammatory response syndrome, and therefore an increased risk of non-survival to hospital discharge. In calves, hypoglycemia was described as concomitant of neonatal diarrhea and neonatal asphyxia, but was also observed during experimentally induced endotoxemia. However, in our opinion, the relevance of this metabolic imbalance in a large population of spontaneously diseased calves still needs to be analyzed. So the purpose of our study was to determine the prevalence of severe hypoglycemia in a large population of hospitalized neonatal calves, to identify clinical conditions that are associated with this metabolic imbalance, and finally to assess the possible impact on prognosis. For the purpose of our study, the data of 10,060 neonatal calves were retrospectively analyzed. Those calves were hospitalized at the Clinic for Ruminants in Munich. And regardless of the diagnosis, all calves were included in the analysis as long as they were not older than 21 days of age. And information about glucose concentration was available on admission to the hospital. This analysis is exclusively based on this single measurement on admission to the hospital. And our analysis mainly focuses on the presence of severe hypoglycemia, which was defined as a plasma glucose concentration below 2 millimoles per liter. For the present analysis, normal glycemia was defined as a plasma glucose concentration ranging from 4.4 to 6.9 millimole, and survival was defined as discharge from the hospital. 100 calves with severe hypoglycemia, the medical records of 100 calves with severe hypoglycemia were additionally reviewed. Those calves were hospitalized between 2005 and 2008, and this time period was selected since a subset of those calves was already included in a previous analysis of my co-authors. The clinical findings and diagnosis of those 100 calves with severe hypoglycemia were compared to 100 randomly selected calves with normal glycemia, hospitalized during the same period of time in order to identify clinical conditions that are associated with severe hypoglycemia. So what we found was that the overall prevalence of severe hypoglycemia in this study population of 10,060 calves was only 6.3%. This graph shows the prevalence of severe hypoglycemia in relation to age of the calves. And what you can see is that the prevalence during the first 2 days of life was significantly higher than in calves that were hospitalized at days 3 to 21. The overall survival rate in the study population was 65.5%. And this graph shows the outcome in relation to predefined categories of plasma glucose concentrations. And what you can see is that severe hypoglycemia was associated with a poor survival rate opposed to calves with glucose in the reference range. You can see that the survival rate in calves with a plasma glucose concentration below 1 millimole per liter was only 9.6% and 26% in calves with a plasma glucose concentration ranging from 1 to 1.9 millimole. In contrast, calves with glucose in the reference range had a survival rate of 74%. We also conducted a second, more data-driven analysis by categorizing calves into 20 groups of 5 percentiles of plasma glucose concentration. And each of those groups were compared to a reference group which was identified to lay best within the reference range of plasma glucose concentration. And the vertical dashed lines indicate a reference range for plasma glucose concentration, and the dashed horizontal line, the overall survival rate. And what you can see on this graph is that in groups of calves up to a plasma glucose concentration of 3.6, there was a statistically significantly lower survival rate than in calves of the comparison group. And you can also see that calves with hypoglycemia had also a significantly lower survival rate, which resulted in a U-shaped association between plasma glucose and hospital survival. Review of the medical records revealed that the proportion of calves with severe depression, recumbency, loss of the suckling reflex, and hypothermia was significantly higher in the group of calves with severe hypoglycemia. However, those clinical signs were not considered to be specific for hypoglycemia. Neurologic abnormalities like seizures or opisthotonus were only documented in only 10 out of those 100 calves with severe hypoglycemia, but also in 4 out of 100 calves with normal glycemia, and this difference was not statistically significant. When looking at the clinical diagnosis, clinical or post-mortem evidence of septicemia was the most frequently documented finding, and this proportion was significantly higher in calves with severe hypoglycemia than in calves with normal glycemia. 37 out of 100 calves had a diagnosis of generalized peritonitis of varied origin, which was diagnosed intraoperatively or during post-mortem examination. And 30% out of those 100 calves with severe hypoglycemia had evidence of malnutrition as indicated by history or clinical examination. This proportion was also significantly higher than in the group of calves with normal glycemia. However, a diagnosis of neonatal diarrhea was not associated with hypoglycemia, and you can see that the proportion of calves with neonatal diarrhea was significantly higher in the group of normal glycemia. We also compared other laboratory findings between those two groups of calves. And on the graph on the left-hand side, you can see the leukocyte counts with the horizontal lines indicating the reference range. And you can see that a large proportion of those hypoglycemic calves suffered from leukopenia or leukocytosis. And on the graph on the left-hand side, you can see plasma lactate concentrations, and you can see that there were markedly elevated lactate concentrations in the group of calves with severe hypoglycemia. A comparison of serum biochemical findings revealed that serum urea and creatinine concentrations were also significantly higher in the group of hypoglycemia, which suggested a higher degree of dehydration in those calves. But despite this finding, a more marked hypoproteinemia was observed in the group of calves with severe hypoglycemia, which could be explained by the large proportion of calves with generalized peritonitis, but also possibly with an insufficient colostrum intake, which might have predisposed those calves to serious health problems. So, having all those findings in mind, our study indicates that severe hypoglycemia is associated with serious health problems, which clearly explains the outcome of those affected calves. Especially evidence of septicemia and generalized peritonitis were the most frequently documented findings in the calves with severe hyperglycemia. So what's the reason for that? As an explanation, this could just be an expression of disease severity and suckling behavior. However, hypoglycemia was also a prominent feature in experimentally induced endotoxemia or septic peritonitis models, where it was related to increased peripheral glucose utilization, a depletion of hepatic glycogen stores, and inhibition of hepatic glucose production. Our study also indicates that severe hypoglycemia should be suspected in neonatal calves with clinical evidence of septicemia, malnutrition, hypothermia, or abdominal emergencies. Previously, coma, severe depression, lethargy, and neurological symptoms like opisthotonus and seizures have been described as clinical signs of hypoglycemia. Those findings were also documented in calves of the present study population. However, it appears difficult to distinguish between clinical signs that are associated with severe hypoglycemia and that they are caused by the underlying disorder. Therefore, it is not possible to diagnose hypoglycemia on the basis of clinical signs, and therefore it is obvious that a concrete diagnosis would require measuring of blood glucose concentration, which is potentially easily possible with those portable glucometer devices on farm. However, the accuracy of those glucometer devices still needs to be evaluated in neonatal calves. So finally, and in conclusion, we can say that severe hypoglycemia is a rare finding in hospitalized neonatal calves, especially on admission. But if it is evident, it is associated with serious health problems and therefore a high risk of non-survival to hospital discharge. Thank you for your attention, and I'm looking forward to your questions.
Right, this interesting paper is open for questions. On the back.
Thank you very much for the nice presentation. Biniji from Free University in Berlin. We had a patient with persistent hypoglycemia in a cow. And the cow demonstrated similar abnormal neurological signs as showed by Mrs. Lawrence. And it was cerebellar ataxia because cerebellum is just the most common target in case of hypoglycemia. And because the cerebellum has limited capacity to convert, to metabolize the pyruvate, for example. And I think, in my opinion, the D-lactosis, high levels of D-lactate in blood may cause just hypoglycemia or just energy deficit, which causes this abnormal neurological signs, especially indicating cerebellar ataxia, dysmetria, as I saw in the videos. So this was my opinion.
Okay. I think that hypoglycemia also influences the clinical picture in neonatal calf diarrhea. But as you have seen in my presentation, the prevalence of severe hypoglycemia is quite low, even in a teaching hospital population. Therefore, I think it does not explain all those findings, or does not explain the clinical picture at all.
Because the D-lactate, it was shown in a study last year, clinical study, that D-lactate could have protecting effect on neurons against brain lesions, for example. And that's why I don't think that the accumulation in the cerebral liquid, the accumulation of D-lactate in cerebral liquid is the direct reason for neurological symptoms. It seems to be the energy deficit seems to be the direct reason for neurological symptoms, in my opinion.
Perhaps you can address it afterwards and we'll take another question. We'll address that question after the presentation.
Thank you.
for your presentation. My name is Troy, and I've been treating calves with hypoglycemia. And they usually has about 20 to 30 milliliters, and then it's very hard to treat them. You know, the success rate is not that much. It's very lower than treating calves with diarrhea. So is it helpful, or is it okay, or is it good to treat them with calves with hypoglycemia, with the fluid, with the anti-inflammatory drugs? I want to know about your opinion.
Okay, I think the most important thing is to perform a fully clinical examination to determine what's the cause for hypoglycemia. How we usually treat those calves is we provide glucose via a continuous drip infusion. Usually we spike a certain amount of saline with a hypertonic glucose solution. I hope this addresses your question.
Thank you for your presentation. Matthew Peterson from Australia. So that would be exactly what we see, those rates roughly, and it's interesting that you got such quite low survival rates in hypoglycemic. The other thing that we notice is that if you go the other way and you get hyperglycemic calves, or you get hyperglycemic cows for whatever reason, prognostically it just seems to be, I think it's associated with a prognosis going either direction. Did you see hyperglycemia in calves? We occasionally see it, and I think it seems to be associated with renal failure, maybe, like when calves are going into renal failure that are very collapsed. But do you have any opinion going back the other way as well?
Yeah. Just go back into my presentation. Here you can see that there were also hypoglycemic calves. Probably the question is, what's the reason for hypoglycemia? One reason could be that those calves were pre-treated before admission with glucose solutions. However, hypoglycemia has also been associated in the first phase of sepsis. This could also be an explanation. Or just stress after admission.
Last question.
Walter Grünberg from Hanover. Really interesting data. I wanted to make the link to the keynote we heard this morning. And Ingrid mentioned that we commonly see hyperkalemia, hyperphosphatemia, and she associated that with acidosis and dehydration. I would add another one here. If you have low glucose, you drop your insulin, you would have decreased shift of potassium and phosphorus into the cell. Did you have a chance, because you have a really huge data set, to look at how much impact you would have from the hypoglycemia / hypoinsulinemia on potassium and phosphorus homeostasis?
I have to admit, I just didn't analyze this for this data set, but we did that analysis for a previous during a previous study, and there was no, or only a very weak association between glucose and potassium.
Okay, I'd like to thank Dr. Trefz and all of the speakers here this morning. Thank you.